Hello friends, my name is Dr. Puru Dhawan, and in this video I will try my level best to make you understand what kind of food a kidney patient should avoid or what kind of food should they take to maintain the potassium level in the body. In a kidney failure patient, it's very important for us to maintain the level of potassium, and the level of potassium can be managed with the help of diet. And in diet, whatever we take, whether it's fruits, vegetables and cereals, everything contains potassium. It can be in lower amount or it can be in higher amount. So it's a very important for all kidney patients to understand what kind of food material they should take to maintain the level of potassium. So let's move towards the vegetable first. Any vegetable which is grown below the surface of earth like potato, sweet potato, turnip has to be avoided by kidney failure patient because these vegetables contains potassium in higher amount. If any other vegetable which is native to your place is grown below the surface of earth, you have to avoid those vegetables. But there are exceptions. Radish, carrot and onion. These three vegetables is also grown below the surface of earth, but it can be taken by the kidney failure patient. Now let's move towards the leafy vegetable. All leafy vegetables are rich in potassium, iron. So in a kidney failure patient, these vegetables are also to be avoided. Vegetable like spinach, pathua, mustard plant has to be avoided in a kidney failure patient. And any other vegetable which is leafy and which is native to your place is to be avoided unless you are completely sure that it contains lesser amount of potassium. So it's very obvious. Now you might be thinking that what kind of vegetable can be taken. Now any vegetable which is grown as a fruit on a plant or a creeper like bitter gourd, pumpkin, bottle gourd, snake gourd, these vegetables can be taken along with brinjal and ladyfinger. So just to make remember which vegetable can be taken, which can't be taken, keep very simple rule in mind. Always avoid rooty and leafy vegetable. If you see a vegetable, you are not sure what kind of, whether it's good for you or not, just keep this rule. If the vegetable is rooty, avoid that vegetable. If the vegetable is leafy, avoid that vegetable. Now let's move toward the fruits and let's see what fruits you can take and what you have to avoid. All the vegetables which I told you, you can take, they also contain potassium. It can be in low amount, but they contain potassium. We can further lower down than the potassium from these vegetables. You have to do a very simple process, and this process is known as leaching. You have to do very simple thing. You have to chop them and soak them for 15 to 20 minutes in boiling water. When you soak the vegetables in a boiling water, what happens that the potassium present in the vegetables comes out in the water, and vegetables become further lower in potassium. By this process, when you leach the vegetables and when you take leached vegetables, these vegetables helps you to control the level of potassium and helps you to further lower down the potassium so that the level of potassium become in the normal values. In case of fruits, portion size is very important. Suppose you are taking some kind of low potassium fruit, but you are taking this low potassium fruit in large quantity, what happens that your level will be increased. So it's very important for all kidney patient to understand what kind of food they can take and how much quantity they can take. In case of fruits, always avoid banana, kiwi, avocado, dates, coconut and all kind of dried food. Other than that, all foods can be taken but in a small quantity, and the portion size for that is 1 cup. Either you can take 1 apple, 1 guava or 1 cup of papaya, 1 cup of melon, 1 cup of any other fruit which you like. Just keep one thing, never cross the limit of 1 cup. You can fill this 1 cup with mixed fruit, you can fill it with strawberry, you can fill it with grapes, but the portion size will remain 1 cup. Suppose you are confused about regarding some kind of fruit or vegetable, whether they contains potassium in high amount or low amount, just simple Google the name of that vegetable or fruit with the potassium content. Suppose you are looking for the potassium content in cauliflower, just Google cauliflower potassium content, and when you do that, there is a value appears, and if the value is under 150 milligram per 100 gram, that means that vegetable is low in potassium. That means that vegetable or fruit can be taken, but make sure that the level is below 150, and if in case of vegetable you have to leach them before cooking. With this, I suppose this will help all kidney failure patients to recognize whether this vegetable or fruit is good for them or not. Now let's move toward the cereals. Which cereals are good for a kidney failure patient and which cereals has to be avoided. We always advise all kidney failure patients to stick to wheat or rice. You can take wheat flour, you can take wheat bread, you can take any kind of wheat preparation, dalia, suji, maida, and other rice preparations like poha and rice flour. But you have to avoid any other cereal item because we are not confirmed what kind of potassium content they contains. So it's better to stick to wheat and rice. Now I think this is sufficient for our kidney failure patient. Now you know about the fruits which are good. Now you know about the vegetables. Now you know about the cereals. This is the main food item which we take. If you have any kind of doubt, you can ask our doctors on the number given below. You can also visit me with an appointment. You can also leave a comment in the comment section below, and you can also fill a form which is given on our website scienckidneycare.com. In this form you have to give us information regarding your kidney health. You have to tell us about your age, your gender, what kidney level you have, either you're going for dialysis or not. You have to give us information regarding your kidney health. You have to give us your name, age, gender, your kidney level, either you're going for dialysis or not, what kind of problem you are facing, what kind of symptom you are facing, so that the doctors at Sai Sanjeevani can evaluate what kind of problem you are facing. With this, allow me to say goodbye. Namaste. See you soon in our next video.